Welcome back to Far From Perfect, everyone. I'm here this week with Tara Woodland, and she is a functional medicine nurse practitioner. Tara, thank you so much for being here today.
You're welcome. Glad to be here.
And in addition to that, so we are both Beautycounter, I call it consultants. I don't know what people call it.
I know. We've been around a while, so I don't know what they call it these days either.
You also homeschool your children.
Yep.
And you also take care of yourself. Amazing.
Yeah, I try.
So can you just tell us a little bit about your background and how you got to this place to where you are now a functional medicine nurse practitioner?
Yeah, I'll try to keep it short, right? Because I always feel like, when someone like first meets you or whatever, and they're like, what do you do? And sometimes you're just like, should I give them the short answer?
I know.
Or the long or the real answer. But so anyways, my beginning stages of being a nurse was a burn ICU nurse. I loved the critical care. I loved the relationships I'd build with those patients that were in our unit forever. But I knew I wanted less holidays, less weekends. We didn't have kids yet, but I wanted more time with my family. So I went back to school and I wanted more. I was kind of at that point where I was like, I'm kind of an expert here. Like, I know I'm not challenged anymore. And so I went back to school to get my nurse practitioner license, my degree, focusing in family, because also I didn't know really what I wanted to do. I didn't want to specialize in anything. I wanted to kind of be that jack of all trades. Mm-hmm. So anyways, I finally graduated from my NP degree or from my NP program, and went into family practice, in a clinic that was part of a system in our area in Minnesota. And I practiced for about 5 years, and I got pregnant with my first son, who's now 10. And kind of through my pregnancy and getting closer to having him and going to maternity leave, I was like, well, I'm really burned out, but hopefully maternity leave will just do the trick. So I went on maternity leave, and halfway through, I told Lucas, my husband, I was like, I can't go back. I can't go back. I was burned out. I wasn't happy. I didn't feel like I was really helping patients. I mean, I know I was, and my patients loved me and I love my patients, but I was like, I can't do this. And so I walked away, like, completely, like, because as an NP, we have to practice to maintain our licensing. And I didn't want to do urgent care, and I didn't want to do weekends and holidays to maintain a license that I wasn't in love with. So I walked away, and that was when Beautycounter kind of fell in my lap. So for like 9 years, it provided me some income so I could stay home with my kids, because we had 2 more, so 3 total. But through that time, I started doing a little more self-teaching of how do I help myself be healthier? How do I help my kids be healthier? What can we do from a natural standpoint? How can I address this? And it really just opened that door. And then as I do, I was like, well, I want more. Like, I'm not good at just, not doing anything with this and not being formally trained. So anyways, I went back into the IFM, Institute for Functional Medicine program. That took me about 2 years fully to go through their courses. And get formal training and then certification, to get, just some credibility, I guess. I mean, I think that's an important part of, I will say, functional medicine. Like, really anybody can kind of claim a functional medicine practice, and some do a very good job at it, but I wanted that credibility, from a really respected program. So then I finished that last year, and then have been back in clinic since beginning of February, I think it was, of 2022. So now, or 2023. I'm like, what year are we in? Yeah.
I know. Everything's a blur.
I know. I was like, well, yeah. I'm like, my youngest is now 4, and I was like, but he was just born like 4 years ago. So yeah. So that's, yeah.
Gotcha. So in your clinic, are there other functional medicine providers that work with you, or is this your clinic?
Yeah. So there's some like legal aspects to like, how do we practice, and each state runs their own kind of criteria for how an NP can practice. Minnesota, we live in Wisconsin, like right on the border. But when we first moved to this area, we lived in Minnesota. And so that was where I always was licensed as a nurse, as an NP. So that's where I practice. And I drive about 45 to 55 miles, depending on what clinic I'm in in the day. But it's myself and another NP, Amy Newman. And I was very particular on who I was going to go work with, because again, I think there's a lot of, I don't know how to say it, like bad eggs in the functional medicine
Sure.
realm, just
Mhm.
not doing great things and not safely doing things. And so I'm very picky in general in life about a lot of things, but who I was aligning myself with and who I was practicing with was of utmost importance, and who was going to kind of take me under their wing, understand where I was coming from, because in theory, I first, when I was trying to get my license back as an NP in Minnesota, one of the women at the Minnesota State Board of Nursing, I was trying to explain to her, I was like, yeah, I'm going through this program. I'm trying to get my license back, and all this other stuff. And she was older, and she was like, do you really think this is a good idea? And I was like, listen, lady, now game is on.
Yeah. It's a great idea,
Yeah.
Linda.
Watch me.
Oh, that's
me.
my favorite. Watch me. Yeah.
Yeah. Her
For
name was
you.
Julie. And there was this hashtag that was like, the F you, Julie. Like, yeah. And now I just want to kind of contact her and be like, I'm doing it. I'm doing it all because, and I'm still resting, and I'm still like taking care of myself and protecting my brain and my mental health. So I'm doing it. But so it's me and Amy, and it's just her and I in that clinic. And yeah,
So I have like 3 questions that
yeah,
are for any nurses and nurse practitioners who are currently listening.
yeah.
Number 1, do you recommend the IFM program?
Yeah, I do. I mean, I know there's a couple others, and I don't remember names of other programs.
Mhm.
But I think from like a credibility, right? Like, I think this is where I'm still coming from a conventional medicine background and knowledge. Like, I don't want to be in the rough, right? Like, I don't want to be looked at as a completely crazy person.
Right.
And a lot of people do. I'm sure of that. But I wanted to be with a respected program.
Mhm.
And I know there's some out there that just aren't as respected, but IFM is an extremely incredible program. And I knew at the time when I was reaching out to my friend Kendra and asking her like what programs she had done with her kind of holistic health training and knowledge, she gave me some ideas. In the first one, she was like, there's this program in Canada that I'm doing, but you will hate it because it is not organized. And I was like, noted, not doing that one. But she's like, I know for the IFM, you can go and do it as a nurse, because at the time I hadn't got my licensing back as an NP.
Yeah.
So you can, as a nurse, do the IFM program. But the problem at that time for me was I have practiced as an NP. So my scope of practice was in my brain was I can diagnose, I can treat, I can prescribe. As an RN, I can't do any of those things. I can do a health coach, which is great, but I think I was going to run into problems with like wanting to do more. So anyways,
100% you would. Yeah.
yeah. Yeah, I
You're
would have
more
been
than
like,
a health coach for sure.
yeah, like I just couldn't do it. I knew I would want more. So anyways, but you can do it as an RN too. And so, and in that breath, like that role would probably look more like a health coach kind of role, right? Which is very like I was telling Amy, and we've talked about this, we're like, we need a health coach. We need someone in our practice where we see them, we help them, we order tests, and we kind of get them started, and then someone can sit down and really spend time like developing their plan and just diving into the weeds that we can't always divide.
I love that, because I feel the same way. I would put myself more as a health coach, but like, I can't run the labs, right? I can't prescribe anything, but I feel like everyone needs both. And yes, everyone. You're definitely spot on. Because I always worry. There's two people I worry about the most: teachers and nurses, nurse practitioners, anyone in the medical field, because how can they not be burnt out?
Yeah. Well, and that's where I think for me, I came back into this fully aware of that position and being burned out, like being so unhappy.
Yes.
To the point where it's like, I don't feel like a lot of people know their burnout until they leave it, right? And then you look back and you're like, wow, I was really burned out, and my sleep suffered. Like I was not sleeping well. I was dreading going back to work. I was, waking up Monday morning and going back. And not that I hated my job. Like there's just things I hated about it. Like and working in a big system, like it was like, you need to see more patients and do more in less time. And it was, all of that. But coming back into this, I was like, I will not let myself, that will not happen, which means I'm only working 1 to 2 days a week. And I know I could do, obviously, just easily add more days because it's not like the demand's not there. But I don't want that, because like and I'm very honest with my patients too, where I'm just like, these are my, like, these are my boundaries in a sense. Like, I'm only in clinic 1 to 2 days a week. I try to be very speedy and responsive to messages and emails and whatnot, but I also homeschool my kids, and they're important to me, and my family's important to me, and my balance is important. So, and they're understanding, like, they get it. But I want them to kind of know, like, and when someone said to me today, yesterday, one of my patients was like, if you're not happy and healthy, how can you take care of us? And I'm like, exactly. Like, I can't. So I want to, and I was just actually thinking about that last night. I think when I was getting ready for bed, I was like, my patient was like about my age, maybe a little bit younger. And she was like, well, I want someone to help me through like my perimenopausal year. She's a little bit younger, perimenopausal years, menopause. I was like, geez, like, she's thinking I'm going to be in this for the next 10 years, And I mean, that's the goal, but I was just like, wow, I got to keep myself, not burned out.
Well, I'm glad that you shared that, because I feel like women just need to keep hearing more stories of women who have either experienced burnout and how they're setting the boundaries for themselves. Like, I can say I am working these days.
Yeah.
This is my boundary, so I can protect myself, so I can be in this for the long haul. I mean, it's just like, your nutrition, you want to be sustainable, your workouts, you want to be sustainable. It's all related.
It's like that consistency, right? Like the term is overused, but it's so crucial. And it's just, it's one of the most important things to anything, is just that, like, not 100% effort 100% of the time, but the effort that you're able to give to keep yourself going. Because I mean, I'm not saying I'm amazing. I am amazing, but I'm not saying I'm not saying I'm the best out there, but I mean, people deserve me in that capacity, but they deserve me happy and healthy. And I'm not talking about like my physical health, which also can take a hit, of course, but like mentally healthy and like, excited to show up and excited to do it. So
and our families deserve that too. And I know me, if I get overextended in one area, that's usually the place that takes a hit first.
Absolutely.
They're the safe zone. They're not going anywhere.
No, you're stuck with me. Sorry.
Poor guys.
I know, right?
So before we hopped on, we were talking about like the difference between conventional medicine and functional medicine. And I would love for you to explain to us, like, what are the labs that a functional medicine practice can offer us that like our regular doctor isn't seeing? And why do we need this deeper dive?
Yeah. So I think, first and foremost, I think in terms of like workup, what I often will start with all my patients, and at the clinic, Heather is she's kind of the jack of all trades. I sometimes for patients kind of explain it like if we were in like a really small town and, Bob was running the gas station, but he also was the town doctor. And then he was also like, taking care of, the gardens out south, but that was Bob, but that's kind of Heather, where right now she's running the front desk. She draws her labs. She, does all this, but she knows like when Tara orders labs, like it is 17 tubes of blood. And it's not to the point where, let me first say too, I think a lot of functional medicine gets a bad rap for being frivolous, ordering more than what we need, and spending a lot of money, spending a lot of patients' money, racking up the bills. But what I will say is I think there's a lot of helpful data in that initial blood work that is really basic. Like, I'm not running any kind of functional labs. I'm just running a more thorough look. I'm having a more thorough look at things, right? So for me, that blood work often will look like, kidney function, liver function, hemoglobin, and the full like white blood cell count, just to cover bases, make sure we're looking at that full picture, full thyroid panel. I'll often do, a zinc, a copper, a magnesium, and then there's other things like B12, B6, folate, homocysteine, just a lot of, and then I kind of tailor it based on what I'm looking at a patient. But those are a lot of what my patients just get at baseline, which anybody can draw.
Oh, really?
Like, so on my Instagram at the top, I've redone it and pinned it, but it's like labs to consider having done yearly. And it's like all those labs, and I'll say a person can take them in and request them. Sometimes it's not the easiest to have someone do that, or have the provider do that. I think one, they're seeing it as frivolous. Two, they don't know what to do with the data once they get it. So they don't
my next question.
Responsible. Yeah. So they don't want to be responsible for it. But I tell, even my patients, I'm like, I tell them not to worry. I will handle it. Like, just order the labs, and it's sometimes too, I have a lab order, like they're handing them the order I've written. So it's my order, it's my responsibility. But that's some of the pushback I'll see sometimes, but anybody can have these labs drawn, but then it gets down to like, how are you going to interpret it? Right? Who's going to do it? So beyond that though, there is a system that we use at our clinic. There's other like ways to go about this, but we use Rupa. Are you familiar with them? Have you heard of them, Kylie? Okay. So it's like, it's a private type of company, but they've contracted with a bunch of functional medicine lab companies, like Mosaic, Diagnostic Solutions. The list is long and wide. And each of these companies have created labs of various sorts, some mold, some mycotoxin mold tests, Lyme tests, gut tests, nutrient tests, neurotransmitters. So we can really just dive into all of this. I think where sometimes like that kickback and that pushback from, I shouldn't say kickback, but pushback from like the conventional world, they're like, well, the tests aren't deemed, the studies aren't there showing their strengths, and, how valuable and valid is the data, like, or is it just unreliable, and untrusted? All of these companies I trust. When I dove into them, I've used them for a while now, and I have favorites of what I pick from which one, like the gut test, which one I run, and there's a few, but I always kind of go back to one. But so oftentimes I think, like, when I start seeing a patient for the first time, it's usually someone that has exhausted all of the workup through conventional medicine, right? Meaning, which is nice. I mean, I actually do appreciate it, because I don't, they can catch some things and at least rule out the big scary things right away, like a cancer type of diagnosis, or, a tumor or a scan, or, just sometimes some things that, once we have all that confirmed that we're not seeing and dealing with, then we can kind of get into the weeds and figure out what's going on, because they don't feel good. So that's where those extra functional tests kind of shine, because, someone with a gut issue, if they've seen conventional, they're usually like, well, they've done blood work, they've tested me for celiac, maybe they've done a colonoscopy, they've done an endoscopy, they've checked for different things and everything is normal. And that's where then I can come in and kind of, oftentimes for that case, like run a GI map, looking really at depth at their gut health and their gut function. And, I had a patient that had that done, and she has a strong family history of some autoimmune gut issues. So I went ahead and sent her to GI just to, make sure that we weren't dealing with Crohn's or colitis or anything like that, right? Like responsible, making sure we're not missing that. And she took the GI map that we ran, and the provider was like, I have no idea what this is. I have no idea how to interpret this or read it. And it was just, the patient was kind of shocked. And I was like, I'm not. Like,
yeah, no, why would they know that? Yeah.
No. And she had a ton of issues on her GI map that we had to address. And so we did, and we are, and she's feeling a lot better. But it was just kind of eye-opening, I think, for her, where she was like, why don't they know how to do this? Or why don't they run this? I'm like, good question. Maybe someday we'll see it.
Well, so for anyone listening, like, what kind of information can you glean from a GI map test that, the regular conventional doctor isn't picking up?
Yeah. So, I mean, oftentimes on that specific test, like I said, there's another one called GI Effects, which is also amazing. I've used that one a few times, and I can't remember off the top of my head, like one has one and one doesn't have it, and then the other one has something else and this one doesn't have it. But I always kind of go back to the GI map. Like that's the one I sit on and kind of always fall back on. But you're looking at things like what we call dysbiosis, right? Very broad term, but basically where your gut bugs, I always call them like the good guys and the bad guys, are just not where they should be. You've got this imbalance between those two. And it can cause raise a lot of havoc. And I mean, it can be from like when I did my own GI map, it was very evident that I was overtraining. All my good gut bugs were just like in the toilet, kind of taking a hit and not so happy. But it could be from years of just poor diet, antibiotic use, just things that kind of take a hit. And what I tend to see is as we get older, our bodies just kind of say, oh, I've had enough. Like, I'm done. I can't do this anymore. And start rebelling. So like that's a big part of it, but it also looks at some yeast, kind of fungal components in there. It looks at how we're digesting our fats, how we're digesting. There's a little glimpse into hormone health a little bit in the GI map. There's an enzyme that we pick up, and can pick up called the beta glucuronidase enzyme. And that gives us a little glimpse into, maybe some estrogen issues. There's pathogens in there too, like E. coli, C. diff. And I always kind of explain it where it's like, that isn't necessarily like the acute infection, right? Where you're vomiting, fever, diarrhea, but sometimes after you have something like a norovirus, or even pick up something like E. coli on a vacation, or, at some point you may get over it, or Giardia, you may get over it, but that can kind of linger in the gut a little bit, causing just this low level kind of, inflammation in a sense. That's not quite the right term, but just unhappiness in the gut.
Yeah.
And so there's tools and things that we use. Sometimes we'll need to do an antibiotic, depending on what we're looking at. Like, and I think that's, this is a bit of a tangent, but I think that's sometimes where I feel like the power that I have as a licensed NP, I can pull out and write a prescription for an antibiotic. If I need to, right? I can write this prescription. I can refill a medication. I can do this, which I think for a lot of patients gives them a lot of peace. Because I kind of say, like, in the holistic health world, you've kind of got two spectrums, right? Like you've got one person over here that's like full 100% on board with just crunchy living, right? Like they've got a bidet, they use they've got, I mean, in a bidet is not, but like there's like levels, right?
Yes.
Of like this realm of holistic health. And then you've got, obviously the complete other side that doesn't believe in any of it and just will trust, whatever their doctor says.
Yeah.
And then you've got these people in the middle that are just like kind of wavering. And I feel like that's my patient, right? Like that's the patient, and I have both sides too, but it's like, they're just like, I want to do this route, but I also don't want to fully like go off the deep end, so I'm like, I meet people where they're at.
Yeah,
but yeah,
perfect.
Yeah.
Love that. Well, I want to backtrack just a second, because I don't know if everyone realizes that overtraining does have an impact on their gut. So can you just speak to that?
Yeah. And I feel it's kind of always funny because my husband and I owned a CrossFit gym for 9 years. So I've seen it. I've seen the overtraining. I've seen what's happened to my 40-year-old women, 35 plus, where it was like they were working out, but they're still gaining weight, and they're now gaining weight more, and they're just taking this hit, right? So it's like, for those of us in our 40s, like we think we grew up in the time where it was like, exercise more, eat less. That will give us the bodies we want. And so it's hard to break that mentally. And you know this more than anybody in, just as more than me, obviously, but it's mentally hard to get out of your head that isn't the answer. So like for me specifically, like I was still CrossFitting, 6 days a week on top of other stuff and just burning it. And my body looked okay. Like I wasn't feeling like I was suffering there. But when I did that GI map, like I could see some damage. I could see on the gut test itself, like all my good bacteria I shouldn't say all of them, a lot of them were low. It was just affecting my immune function in my gut. Like there's a test, that's another part of that GI map, like a secretory IgA, which is the immune function of the gut, kind of tells us how effective your gut is at fighting off insults. Mine was low. And then you kind of look at blood work, and my reverse T3, which is an inactive form of the T3 hormone in your thyroid, was low, or excuse me, was high. Which is often an indicator of kind of stress on that body. And then you can do some cortisol testing, which also kind of just confirms that picture. But yeah, I mean, but you need that time to recover. And if you just keep hitting it and hitting it and hitting it, it's not the answer, long term.
And it is so hard to learn, like, especially if you are, I mean, everyone listening to this is pretty much just like us, right?
I know.
Hard workers, they're going to go do the thing. You don't need to tell them to go work out.
Yeah.
But I liken it to an addiction, honestly. Like
it
it's
is.
so hard to stop.
Yeah.
You see evidence like that, you're like, okay, maybe that isn't the way.
Yeah. And I mean, I think some people do need the evidence, right? Like when I can talk to her blue in the face, but they need to see the data. They need to see and be proven that it's causing a problem. And even then it can be hard. So, I mean, I get it. Like,
I 100% get it. I have to learn things the hard way myself.
Yep.
So talking about women in their 40s and perimenopause, can we have a discussion on HRT and think about it? I love the idea of it. But I'm not a professional.
Right.
Can you just talk about, is that an option for women? Should we be looking at this?
Do you use it? Let me ask you, do you use it?
I use a little bit of testosterone.
Yeah.
And not pellets.
Yeah. So I think, and we could have probably an hour-long conversation on that. So I'll try to keep this, and so I apologize too, because I know I'm kind of chatty. And I try not to be, I apologize, but HRT, I think a lot of the discussion in terms of harm that comes from it stems back to that Women's Health Initiative study back in 2002. And when it got released, it kind of shut down the world from an HRT perspective. Women stopped being prescribed hormones for the most part. And so basically like two whole generations or a whole generation were just withheld hormones. And so I am a big fan of hormone replacement therapy when it's done correctly, meaning the right patient, the right dose, the right medication, and the right method of using it too. I think it just depends on, various factors, like what you're really trying to address what the patient interested in, what they're able to stick with or do, and risk factors and benefits and all of that. But I am a huge fan. I think when the time comes and people need something, it's not just about the symptom control, right? Because I think for years that was kind of the messaging where it was like, oh, hot flashes, here's some hormones. But we know now that it can help with brain health. It can kind of protect the brain a little bit. It can protect the heart, cardiovascular system. It can protect the bones, and muscle and just longevity piece. Where I'm like, if you're going to tell me that I can, have a better outcome in that respect, I'm in. Like, I want to not just live to be 100. Like, I want to live to whatever decade I live into, feeling great, active, healthy, mind is clear, that kind of thing.
I'm with you. And when you made a great point on your Instagram, like people are they will prescribe birth control to girls who are 13 years old or however old. It blows my mind. I'm so glad I don't have a daughter. But like, why will you do that? But you won't do this.
Right. I mean, I think it's one of those things where it's like, how I explain it to my patients, I'm like, I'm not trying to give you a bunch of hormones to like shoot you through the roof or to give you a level you wouldn't have, normally. I mean, obviously in menopause, like you're not going to have that level, but we're just trying to give you enough to just mitigate, those symptoms, those issues. And so it's like, no, I mean, I would rather go a little bit longer with those hormones in my body, and mitigate the quick effects of aging once they drop off. So.
Absolutely. It's a tool. I'm going to use it if it's going to work, if it's the right tool for the job. And like you said, for the right reasons.
Right. I mean, and like for me, I'm on a little testosterone right now. I just started it a week ago. But I know and I'm on some progesterone too, because I've done my hormone testing and I've done it several times and I've tried different things. I've tried some Vitex, I've tried some other stuff, and it just hasn't been enough. So like, it's time. Like, I need to not be as moody.
When that progesterone goes, man,
it's nasty. And it's funny because it's like the conventional world. Like I just saw a patient, yesterday or a couple of days ago that she was like, yeah, my provider, I was having such anxiety all of a sudden and like moodiness. And so she gave me some antidepressants and I'm like, that's not the problem. Like, it's not just, I mean, there's exceptions. So I never want to say a hard, fast rule, but that probably isn't the problem. Probably just need some progesterone. You probably just need a little bit of, balancing back out because you're on a roller coaster right now, hormonally. But yeah, so.
That's crazy. I know. Just a quick aside. I just remember I just said to my husband, I was like, I'm sorry. Like, I don't know that whatever just came out of my mouth. Like, that was like not me, but it was me, but it wasn't me. Okay. I'm so sorry.
Yeah, I hear you. And it's like, gosh, I just feel bad for those men in our lives.
I know.
But it's funny. It's like when women come in, they sit down, and if we're talking about hormones, it's like, they don't even need to talk to me. Like, I can tell them what they're about to say to me because I've heard it so many times. And it's, and I mean this in like the kindest, most loving way. It's a broken record.
Yeah.
And it's like and also I just want always them to know, like, you're not alone. Like, you're not alone. This is completely normal, but we can do something about it.
Yes. Well, hormone therapy aside, what are these other lifestyle factors that you recommend for the women that you work with, to help manage their weight and support their hormones that aren't hormone therapy?
Yeah. I mean, and I think you speak to this a lot. So you always like nail it on the head. I think as we're getting into these ages, like 40s plus, I mean, even younger, but I'll just kind of hit those specifically. It's focusing on a lot of what I call the basics, like the monotonous, mundane, easy, but also not easy, because we've been adapted to the fact of like, we have such busy lives that we start to, cut corners on sleep and eating and, the basics. Like, I find so many of my women, and you see this too, I know, aren't eating enough. They're not fueling their bodies. They're definitely not eating enough protein, not getting enough sleep. And that's a bit of a catch-22, because as progesterone drops and hormones, your sleep starts to suffer anyways. So it's like a loaded gun, like up against brick wall. But I think those are some of the biggest things, and, making sure that you're getting enough, fluids, but minerals and just sunlight and all the basic things is very important.
Speaking of fluids and the minerals, how do you feel about like the electrolytes, like the element and whatever? Are those necessary?
I don't want to say they're necessarily, but I think they can be very helpful. What I tend to find is I have like kind of two types of patients. One that drinks amazing amounts of water, or one that doesn't drink any, or very little. But the ones that are drinking a crap ton of water, for a technical term, I'm like, you're not doing yourself any favors. Like, you're just diluting your body. So that's where I sometimes will come in and be like, add in a packet of electrolytes in a day, especially if they're very active, but like, stop drinking your 200 ounces of water, like, and not stop drinking the fluid, but like, let's shift it. And what kind of water are you drinking? I mean, this is where sometimes I don't get that like nuanced with everybody, because it's just not appropriate for every patient. Yeah. But if some patients are like, they've done a lot of the work, where I'm like, now we get to get into the weeds and like really get nitpicky, I'm like, stop drinking your tap water, like, we need some, good sourced water, because yes, you're drinking a lot, but it's also not the best quality, and you're not really doing your cells any favor.
So interesting.
Yeah.
Like, that's not something that's always on my radar, but I also need to drink more water. So
yeah,
like, when you talk about the basics, like, I'll be the first to tell you, I need to drink more water. I need to eat more vegetables. Yep. And I'm like, if I need to do that, I can only imagine what other people need to do.
Yeah. But I mean, I think for me too, always again, I think this is, being in my 40s, I've lived enough of a life in different like swings of, perfectionism and, drasticness, where I've done the strict, I've done like, I won't let myself fall off this and do this way of eating. And now we're living a little bit more balanced life because young kids and busyness, and we just need to, and my peace and my mental health and my happiness. Right. Yeah. But I think for patients, like, oftentimes they will come in and they'll be like, okay, tell me everything I need to do. And I'm like, well, I can, but I also need you to do this for the rest of your life.
Right.
And I'm like, I don't need you to change all the things at once necessarily. Just work on your protein.
Yeah.
I don't care what you're doing for your carbs. I don't care what you're doing for your fats right now. We'll figure that out later. Just make sure you're getting enough protein. And I think it shocks them sometimes because they expect like a complete overhaul, and I will gladly do it. But I also know, like, if you come back to me in a year, are you still going to be doing that? Probably not. So
I know it's like, it's counterintuitive. Everyone thinks like, oh, I should change everything at once. But again, at 40 years old, we know what works. I mean, even for ourselves, I can't say that I'm going to clean every room in my house every single day.
Right.
When I don't clean any of them now, ever.
Yeah. Let's be real. Let's be real.
So the last thing I want to ask you about, we had this little brief discussion before we started before I hit record about Hashimoto's, because I was telling Tara, I like see it on every intake form that I see come across my desk now. And I just wanted to ask her, like, what's the prevalence? Why am I seeing this increase? So let's have that discussion.
Yeah, I think, and as we chatted, like, I think some of it is we're checking it more. I think more people are actually, becoming more knowledgeable. I think it's the benefit of social media where there's information's at their fingertips. Like, it doesn't take much to find information out on the internet and the interwebs. But I think that's part of it. Like, we're now checking everybody's thyroid antibodies so we can pick it up sooner. But also, as I was telling you, like, it's complex in the sense when we start thinking of like an autoimmune condition, which is what Hashimoto's is. It's antibodies being developed to your thyroid gland, like anti-antibodies. And these antibodies are attacking, for lack of a better way to say it, your thyroid gland. And when we talk about these autoimmune conditions, we believe that there's a little bit of a predisposition in the sense of like genetic and a trigger and a leaky gut. So there's usually a gut component, which is why a lot of my patients, well, all my patients get screened for gut involvement. Very rarely do I have anybody that doesn't have some kind of digestion issues, not pooping every day or some bloating or, which you shouldn't have any problems really in theory. But that triad is the kind of the autoimmune picture. So add in Hashimoto. So now we've got a thyroid antibody happening. And I think it comes down to some of the things we've already talked about, right? Like lifestyle, what we've done, how we've burned ourselves out for so many years and just not taking the best care of ourselves. And so it's like, that's why, like with my young patients, I'm like, just trust me. I know, like, you hear it often probably from your mom, but just take care of yourself. Like, get enough sleep and make sure that you're, that you're, sleeping well and, eating your protein and, all these things that you don't want to hear at 20, but,
Right.
it's just, yeah, like we've hit things pretty hard. And I think for us, like, especially at, 30s, 40s, like our generations kind of saw, the chemical revolution in the sense of like all like Teflon getting developed when we were kids and, getting exposed to a lot of these toxins and, artificial dyes and, artificial sweeteners and snack wells, we kind of,
I mine just went. Yeah.
And I think you can't just pinpoint necessarily one thing, but I think it does play a role. And then what I was saying to you earlier too, with this is what we see a lot with these, especially Hashimoto's, but other autoimmune conditions that kind of come, and I say this term kind of loosely, but come out of nowhere, where it's like you're fine one day and then not fine. I've seen a lot more too with like illness, like severe illness, like with the COVID illness, people that got pretty sick, or some people that weren't even super sick but got it. I think it was enough of an insult to the immune system that kind of blew those doors open. So my coworker explained this to a patient one day, and I was like, that is an amazing analogy, where it's like we have these closets, like these immune closets that just kind of are bursting at the seams, right? They're getting filled with like toxins and stress and gut health and genetics. And it's just like these closets are getting filled. And then all of a sudden something comes in, like even a major life traumatic stress or a big stressor in the life. And it just blows those doors open. And now all of a sudden here's Hashimoto's just plugging along. So I think it's complex. There's not just one thing, but it's a multitude of things, but that's kind of like a little bit of a glimpse into kind of what we believe to be the insult to injury.
Well, and then like, speaking of COVID, I was having this conversation with someone yesterday, because I think that, and tell me, you see people every day or, once a week, however you're talking, your clients, patients. I feel like we have PTSD from COVID, to me, COVID years were great. To be honest with you, I'm an introvert. I thrived. It was great for my business, but still my life, I'm a different person now. And it was hard on a lot of people. And I just feel like it's probably impacting people more than they realize. So when you think about these closets getting full, you don't realize your deodorant you're putting on every day. And then the fragrances and the candles. And I mean, it's just, like you said, just pile on top.
Yeah, it is.
Do you think there's a long-term impact of COVID? Not just long COVID, but
Yeah. I think so. I mean, I really think so. And I think it varies. And I think obviously this conversation is very polarized. Like we've got people that don't believe COVID even existed, that it was, so I try to this is a well-known statement, but I think, I've heard in the past, and I just hung on to this where I'm like, I feel like the truth is often in the gray area with a lot of things. So I just kind of live there. Where I'm like, well, it could be the case, or I don't know, we'll just kind of keep chugging along, living my happy life. But anyways, I think so. And I think, just the isolation that a lot of people had, and just from a mental health standpoint and a health standpoint and an immune standpoint, and just, I don't know, we'll just see I don't know. I think so. I think we'll see a lot.
But and either way, like all the more reason to like take control of your health. Because that's the only thing that's going to help us, doing everything that you talked about.
Yeah. I think it's important. I think in the end, like I do see a lot of patients too, where they're like, yeah, it kind of opened my eyes to some things, like, how the healthcare system works and how we, operate. And I was like, yep. I'm glad you're here.
Glad you're here. Glad you made it.
Glad you made it. Glad you're here, now. And they just started questioning things like that, I think that's how it starts for a lot of people, where they're like, it just made me go, and maybe I should look at this a little differently, or kind of address my health from a different perspective, and take a little more ownership on it. So
all for that. I know that I always say that's my healthcare plan, is just owning it.
Yeah. I often will, most of my patients will get asked, like even just yesterday, one specifically, I was like, what do you think's going on? What do you think? Like, and I tell them, if they don't really know me, I'm like, I'm not asking because I don't have a clue, or I don't know what I'm doing, but there's so much empowerment. And like I shared in my stories, this morning, it was like, this meme that was like, the doctor says, well, don't confuse your Google search with my degree. And then the patient goes, well, don't confuse my 10 years of living with this disease to your 1 hour lecture, on this disease. And I'm like, it's so true. Like a patient's there because they aren't the expert fully on everything, and they need some help, but they also are the expert. Like they know a lot. And I do believe a lot in intuition, and kind of that, I'll say that gut feeling, right? Like, this is what I think. And then that allows me to kind of get an insight into their brain and what their mind is thinking, to kind of either reassure them, like yesterday I had this nurse as a patient, and she knows a lot, right? And she's like, I'm afraid I have cancer, and I'm afraid I have this, and I'm afraid of this, and I'm afraid of that.
Nurses know too much.
I know. And I was like, at the end, she's like, you know what? It just felt really good to get that off my shoulders and say it, and just not be, afraid to say it. And I'm just, I just want, I want to address people's concerns. And I think that empowerment there is so important for people.
Absolutely. Oh man, your patients are so lucky. So you're licensed in 2 states right now, right?
Right now, yeah, Wisconsin and Minnesota, and I'm working on my Iowa license. It's just like, as we chatted at the beginning, it's just a lot of hoops to jump through. So hopefully sooner than later.
Right now you are. I mean, and you got 3 kids and you're taking care of yourself. So
I know so many times people like on my social media friends, they're like, when are you going to get licensed in Georgia? When are you going to get licensed in Colorado? And I'm like, I know, maybe someday. Well, and some of it's like, I can't practice independently in every state because of state regulations. And so it's not really useful for me to get a license there because I can't do anything anyways. But yeah, so someday.
Well, but I just learned from you. Like I can't use you, but I can still learn from you on social media. Where can we find you, Tara?
Tara Woodland was it underscore? Is that what it's called?
Yeah, that's one of those things.
FNP.
Love it. I'll make sure everyone has access to that. I am so grateful for your time, the stories that you shared. You're the best.
Thanks. Sorry for all my tangents.
I love the tangents. All right, Tara, talk to you soon.
All right. Bye.